In the last year and a half, what have you seen, transpire within the RISE program? What are you hearing from kids and adults?
Yeah. I think what we've really seen is a continuation of a trend that was already establishing itself with an increased demand and need for mental health services. I think the pandemic kind of exacerbated that existing trend, and it's kind of skyrocketed in terms of the need for these services and the need our community has. We've seen a lot of adolescents and adults meeting criteria for depression and anxiety and really struggling during this difficult time for our community. And really, it's just a trend that has been clearly well established, and now, this is just another thing to exacerbate it.
And are you surprised to see, the increase of people needing help because of the pandemic?
Not at all. I mean, these are, there are very few pandemics in the modern era. And, if you look at the last one in 1918, psychiatry was still relatively young. And so we didn't have a good sense of how these things impacted populations. But certainly following trends like this and endemics around the world, you see a significant increase in mental health needs. Certainly this is a prime example and one of the few in the modern era that we really have a sense of what happens from a mental health perspective when this happens. And it's a huge stress, in many ways an existential stress on families, communities, and in this case, the nation.
When the pandemic first started, we thought it would be a few months, and here we are 20 months later. But looking back when it first started, what were your, I don't know if you had any predictions of what the stress would be on people mentally, and if it's if it's hit your expectations. Does that make sense?
Yeah, I mean, having, again, like our field this is something unique and almost a new experience for most people in psychiatry, that it was really hard to have predictions. We knew that it was going to be difficult for sure. I don't think we knew to what degree it would be this challenging. I think, it's multifactorial, right? What we saw first was people were anxious about what does this pandemic mean? Am I safe? Is my family safe? Are members of my community going to impact? There was a lot of unknowns, so there was anxiety about that uncertainty. And then as it became clear what this really was going to be like and how it was going to impact our lives, people settled into that. And there were periods where hope was maintained, but I think as it dragged on and has dragged on, like that hope is really what's being tested. And you just see people really getting exhausted. I mean, this is exhausting.
What are you seeing in your patients? In the general sense, depression, anxiety, related to the pandemic, would you say?
So, I work primarily with adolescents, and I've worked with very few who say the pandemic is the greatest source of stress in their life. What they do say is they've been under a lot of stress prior to this, and this has just been another contributing factor that, and sometimes is what kind of pushes things over the edge in terms of needing really intensive treatment. I think adolescents are really resilient. In some ways, their experience hasn't paralleled other populations during this pandemic. I think really what it comes back to is, again, kind of this existential anxiety just about their own existence. What is the world they're inheriting? Things like that. And while they may not always articulate it specifically, you kind of get that when they talk about lack of hope and uncertainty for what their future is going to be like and the future of their friends.
And have you seen, a change in some of the students when they had to go back to school, when they got to go back to school in person compared to when they were learning remotely?
Right. So I've talked about this before, that we saw a trend when this first started and schools went all virtual, is that kids who were previously really anxious about school and would avoid school, in some ways took a little bit of relief and comfort not having to go to school any longer. And what we found was the kids that really depended on the structure and the support offered by school, they really began to suffer when that was taken away. And so we've seen kind of a transition back to kids who really struggle in school. I think it was even more of a challenge having to go back to school after a year or more not being in person. It really challenged people in terms of their anxiety.
For you as a clinician to see kids go through something like this where they don't have control, we don't have control over the pandemic, right? Not as much as we can or should. But how does that make you feel to see, them go through this with something they can't control?
I think the adolescents I work with and the adults work with, they're all experiencing this in the same way in terms of a lack of control, a lack of how can one individual possibly make a difference in something so monumental. And we see that in a lot of things going on in the world today, just beyond the pandemic. And so there's really is this pervasive sense of hopelessness and uncertainty about what the future holds, particularly for young people. They're not sure what the world's going to be when they inherit it. And they feel in some ways really powerless. And so it's heartbreaking to see young people who aren't filled with hope. Because when I think back to my youth and my adolescence, like that was a really exciting time because there were so many opportunities and potentials for things to come that I think a lot of these kids aren't able to share in that experience. And it's really tragic.
What signs can parents see in their children where they need more help?
I always say, we can't just rely on what our child or our adolescent is telling us. Often it's a change in their behavior, things that we observe. So I always say if there's a dramatic change in their behavior, and that's change in their sleeping patterns, change in their energy level, change in their appetite, are they eating more, are they eating less? And then are they isolating? Are they staying in their room when they otherwise would have been joining the family or going out with friends? Are they no longer doing the activities that they once loved, right? Are they withdrawing from extracurriculars? Are they no longer participating in sports teams? Do they just seem lethargic? Are they less talkative? So these are the signs that something more is going on. And they may not always be able to articulate what that experience is, but what's happening essentially is their body is showing that they're struggling with either anxiety, depression, or certainly other things.
What about adults? What signs, would it be the same signs? Yeah.
Well, certainly, adults experience significant behavioral changes when they're struggling. So a lot of the same things apply, right? People isolate, they stop spending time with their friends. Instead of going out on the weekend, they may just be isolating to home, a little energy, a little motivation to do things. We also see relationships struggling, right? They may not be functioning as well in romantic relationships, relationships with friends, relationships with family members, because it requires a lot. And when you're feeling depressed, the energy required just to connect with people can be overwhelming and exhausting. Certainly adults often are able to articulate what they're experiencing a little bit more. And so it's helpful in that sense that you get that perspective on what they're experiencing and going through. But certainly a lot of the same things apply.
How can a friend or family member approach someone who they feel might need more help?
I think at the end of the day, it's kind of the fundamental things we do as people, and just connect and ask them how they're doing and be sincere in that. And really try to get a sense of what they're going through and learn about their perspective. And offer yourself up to spend time together. Like if you notice your friend is withdrawn and they're just staying at home all weekend, you may not be able to get them out to join you, but maybe you just go and sit with them, and that can make a huge difference. And it's just having these honest, open, supportive conversations. And if you do feel that after having those conversations that more is needed, then you suggest it, and you can offer yourself as a resource, like, hey, could I help you get an appointment status? If it's really severe, could I help you get to the hospital? I'll stay there with you.
What would you say to parents who may be seeing these signs in their kids, but are, maybe a little bit afraid of, they are feeling depressed? I don't want my kid to be going through that, but I don't want to accept the fact that they are going through that.
I think, denial is a natural defense. We all do it almost on a daily basis in one aspect or another. Certainly when it's something this significant, I think it can do a lot more harm than good. And we know that without treatment, these things tend to get worse. And the sooner we get treatment, it also helps curb kind of the potential for these things to get worse. So the earlier interventions, the better. I tell families that whether or not you admit that your child is struggling, whether they're depressed or they're anxious, whether you give it a title or admit to it, it's still happening. So it's not like suddenly it comes into existence because you named it. It was already there. And so I just encourage families that, yes, there's still unfortunately stigma around this. Yes, these can be really hard things to come to terms with that's happening to your family and to your child. But really, it's reaching out and connecting with your resources and sources of help to get your child feeling better.
Kids can't self-refer themselves to the program, can they? They need a parent permission.
So, the state of Washington, the age of consent for mental health treatment is rather young. It's 13. So a child, in theory, could refer themselves. I don't know if we've ever actually had that. That's something I'd have to find out. But certainly, I mean, kids can, we see kids in the emergency room all the time who have asked to go there themselves. So yeah, I think in one sense, yes, they can absolutely do it. I think in a practical sense, it becomes hard because, we really want families to be involved. But certainly there are cases where that's just not possible, and that's okay.
When you mentioned the emergency room, so do you get called down there for referrals or anything very often?
At the start of the pandemic, I was helping see kids in the emergency room and who were hospitalized just on the medical floor at Sacred Heart. Since then, we've brought on a new psychiatrist to help with that. And so right now I'm not, but one of my colleagues is responsible for seeing a lot of those kids.
But was that for medical or for mental health?
I was seeing them for mental health reasons,
Okay.
and the colleague is doing that as well. Yeah.
Okay, so would you say you saw an increase in kids coming in for mental health in the hospital?
Absolutely, and we know that this has been the case for the pandemic. I mean, it's in some ways it's almost an exponential climb. It's just been really dramatic, and it seems to be continuing. And it's just putting a lot of strain on an already strained system, for sure.
I guess anything else you would like to add about all of this?
I think at the end of the day, I mean, I don't think issues like this are individual. I think they're communal. I think when one child is suffering from these things, the whole community suffers. And to that end, I think to really address this in a meaningful way, it's a whole community effort. And it's not just healthcare, it's everyone who's involved and invested in these kids' lives. And we need to take an honest look at what is going on that this is happening, right? And that's something this systemic, this significant, impacting so many children. It's something greater than what's going on at an individual level. And any sort of solution or fix will come from that higher level as well.